Alrighty, righty. I think we're getting ready to start. Um, yeah, welcome everybody. Thank you for joining us tonight. Um, Welcome to Ingersoll Gender Center's Gender Affirming Healthcare Panel, which is part of our Trans Awareness Week programming. As I mentioned before, if you could take a few moments to edit your name to include your pronouns, that would be great. This evening, we'll be using the chat functions to interact with one another and ask questions of our panelists. Please be respectful with one another and patient. We are all in the process of learning, and we will do our best to get as many questions answered as possible. My name is Kaya. I use they and them pronouns, and I am the development manager at Ingersoll. Ingersoll is a not-for-profit organization by and for transgender and gender diverse community that focuses on direct service and community support for trans and gender diverse community in Washington, advocacy, community events, and we have the longest running weekly trans peer support group in the nation, running 40 plus years weekly. You can tune in to our other Trans Week of Awareness programming by following the links in the chat. But here's a preview of what's to come in the next couple of days. Tomorrow, we have our trans support group. It runs 7 to 9 p.m. and runs every week. On Thursday, we have 2 events happening. We have a free employer training, which is transcultural competency, open and free to anybody who might be interested in making their workplace more inclusive for trans folks. On Thursday, we also have a panel of intergenerational voices. We're talking to trans leaders, artists, advocates from across the generations and just bringing them into dialogue. And on Friday, which is Trans Day of Remembrance, we will be signal boosting vigils organized by Utopia and the Black Trans Task Force. So you can find and follow us, Utopia Seattle, and the Black Trans Task Force for details and updates on any of the commemorative events that will be happening on Friday. If you're interested in supporting Trans Week of Awareness and our ongoing work, you can make a donation to Ingersoll. We'll drop the link in the chat. And now I'm going to pass it over to my colleague, Mattie, and our panelists. Thank you so much for being here today. Take it away, Mattie.
Hello, and thank you, Kaya, for that introduction. I am Mattie. I use they, them pronouns. Please excuse the lighting situation. The lights in my house I feel like are not very bright. And so I'm kind of having to have a kind of impromptu lighting setup here. Like I said, my pronouns are they, them. I'm the Healthcare Access Manager at Ingersoll Gender Center. So I support community members by assisting them in building appeals cases when they receive denials. I create and hold various trainings for medical providers who would like to better provide gender affirming care. I also play a significant role in Ingersoll's healthcare access policy work and making sure that our state HCA continues to make positive changes in the ways that our community accesses healthcare. But tonight, and without further ado, I would like to introduce you to our panelists. First panelist we have is Ash Choi. Ash is a master's level mental health therapist in Seattle. Their practice and therapeutic approach is informed by an eclectic mix of psychological models, along with anti-oppression, queer, and feminist theories. Ash identifies as a non-binary queer person and lives in Seattle with their wife, kiddo, guinea pig, and wonder dog, which we had the privilege of seeing a little earlier. They work with folks of all stripes, ranging in age from 11 to 100 plus. They specialize in gender identity exploration, as well as the spectrum of disordered eating and eating disorders. So thank you for joining us tonight, Ash. We are happy to have you. Next, we have Rachel Beda. Dr. Beda is a primary care physician in private practice at Wise Patient Internal Medicine. Her practice considers each patient's individual needs and strives to accommodate everyone. In addition to general primary care, Dr. Beda's particular interests include providing gender-affirming care for transgender and non-binary individuals, mental health, and medical weight loss. She is deeply committed to providing outstanding medical care with a focus on equity, empathy, and social justice. Another thank you for being here tonight. We really appreciate it. And last but not least, we have Peg Maas. Peg Maas is a physical therapist and certified lymphedema therapist and pelvic health clinical specialist. She practices with outpatient rehab services at the Swedish First Hill campus. So if everyone can type in a warm welcome for our panelists in the chat box, we will start with our first question. I think the first question, and what I always like to know from providers, excuse me, the light is in my eye, is what inspired you all to learn more about gender affirming care, and then take the steps to make sure that your patients are able to access that care through yourselves and your practice. And this is a start for anybody.
I can go first. So I was unfortunately not taught anything about gender affirming care in medical school or residency. I graduated from medical school in 2001, so it had not come far enough yet. So I was taught how to do it on the job, so to speak, at Pike Market Medical Clinic, which is the first primary care job I had after leaving Harborview. And I was taught by providers there that had been doing it, who learned from providers before them, who learned from providers before them. Pike Market Clinic was one of the first clinics in Seattle that provided transgender healthcare way back. And so I learned how to do it there. It was a little bit nerve-wracking because, we're so taught in medical school, like evidence-based medicine, you have to do something so many times under supervision before you should be able to do it yourself. And so this was a bit of not the way I'd been taught, but I realized like how important it was, and how much I could help by just saying yes. And so that's sort of how I try to practice, is like try to say yes unless there's a really important reason to say no. And so that's how I got into this. It became one of my favorite parts of primary care. And I've been lucky enough to have been doing gender affirming healthcare now for a decade. So yeah.
Awesome, thank you. Anyone else wanna take a crack at this question?
Sure. So I actually came into the work, aka therapy, about 2.5 years ago. And I think a lot of my work now with the trans, queer, plus community is because of my own experiences, having fallen into the world of who am I, what am I, how do I figure this out, what options are there? And there were really key people in my own process that made me feel like this wasn't crazy, and that there wasn't anything wrong with me, and that there are so many resources that really aren't very accessible without knowledge. So a lot of my work, especially with trans, non-binary identified folks, is one, I have a behemoth database of referrals. If you're interested, email me. So definitely connecting people with information. And then I often find that folks, not everyone, but generally speaking, have a lot of anxiety around figuring out what the answer is, so to speak. And so really what I love doing is working with folks to expand space and permission within themselves to be able to be okay, at least in the short term or maybe long term, with not having to know. In any case, that's my response.
As for me, it's great to hear what you guys have to say. I just have a lifelong fascination with bodies and how they move and how they reflect what our life experience is. And although it wasn't my intention in being a physical therapist to ever be a pelvic health PT, I was basically enrolled in it by my then boss 30 years ago, and I learned what pelvic health PTs could do. And my very first patient was a trans person, and I realized I was completely unprepared for that. And I think that person was kind and opened doors for me to understand their experience. And in the aftermath of that, I thought it's my responsibility as a healthcare provider. I like to say that I treat all ages and all genders, but at that time I realized I just needed to learn. And so I have done my best to learn in all the ways that we learn, cerebrally and emotionally, and from the kindness of people who wanted to give me feedback and help me understand their experience, as well as the more cerebral learning and continuing medical education. So that's my experience so far.
Thank you for that. One thing that I noticed from all of your answers is that similar to the ways that the trans community has always utilized community care to get its needs met, is the same way that a lot of providers utilize kind of community care within the medical community to get their to get knowledge about how to provide gender affirming care. So I just thought that that was kind of cool and something that I noticed. But I will move on to the next question. Often as trans folks exploring forms of medical transition and talking to providers about options, we can sometimes struggle with the feeling that we don't know what we can or cannot ask for, or that we should already know something that we're still figuring out, or that we should present ourselves in a certain way in order for a provider to provide us with the care that we're looking for. At Ingersoll, we've gotten that sentiment a lot, and in response have created a self-advocacy guide and video, which will be posted in the chat box. However, based on what you see in your own practices, do you have any words of advice or information that you would want trans audience members to know so that they might be able to better advocate for themselves and their medical needs?
That's a really great thing to ask us, and I think I'll just start by saying I see folks in every, like, the whole spectrum of their journey. I see folks, like I had even a couple of patients who started seeing me for primary care, didn't even realize that I did gender affirming care, and after they've been my patient for a couple of years, then they initiated a conversation with me. So, and then I have folks who have come in who have been on their post-op, they've been on hormones, they've been through their whole journey, and all they need from me is primary care and like maybe a once a year hormone check. And so I have people all along the way. I have people who present differently sometimes every time they come in. I have people that know so much when they come in to see me for the first time. They're so educated. And then I have people who know very little, except that they know that they want gender affirming care. So there is no right way to present. There is no typical way to present. There is no right. There's only how you are. Come in how you are. I mean, we try to say, like, just come as you are, and we mean that, like, really just come as you are. And I would say, if you're feeling like you're wrong when you go to a medical provider of any sort, then it's probably not you that's wrong. It's probably the medical provider and the clinic that's wrong for you, because like however you are is right.
I think, oh, Peg, I just saw you on mute too.
Oh, that's okay. That's okay. Go ahead, Ash. Go ahead.
I think my response is really similar to Rachel's. I see kind of both things. Folks who come to therapy ready to engage with this, aware that this is their experience, and folks who start therapy for a myriad of other reasons. And, you know, whenever it happens, they share that this is something that they're thinking about or something that they've known for a long time. And what I'm open about, just in terms of like marketing myself, is just disclosing like I'm queer. Maybe you can guess by the way I look, but that I really, really believe, same with Rachel, that there is no there is no right way to be, and there's no wrong way to be either. And so I like to preempt that really with all my clients, which I do in kind of like first, second sessions, just as a way to start normalizing this experience of gender and being in a world where slowly it's becoming more known, but that there's a lot of judgment and sometimes policing around identities that I just like to kind of speak against or offer a different sort of message right off the bat.
And I would echo what both of the other panelists have said so well. And I oftentimes say to people, you hire essentially your providers. And if you don't feel like you are really comfortable, and you don't feel comfortable telling us, you know, how we can make you more comfortable. I mean, I just always want people to feel like they are in the company of providers they feel comfortable with. So I let people know right off that I welcome their feedback and their pushback and whatever it takes to feel like they can be authentic. And so I know that it happens a lot, and it just makes me sad to feel like people need to have any sense of pressure at all to change anything about themselves for their provider in order to feel like they will get good care.
Thank you for those answers. I really appreciated those. Peg, sorry to put you on the spot again, but this question
okay.
is for you. But this question is for you.
Okay.
When folks typically think of gender affirming care, folks don't often think of the ways that PT can be helpful in supporting that feeling of being at home in your body. When I heard about the work that you do 2 years ago, I was actually pretty floored, no pun intended, about just how much of an impact that PT can have on issues like pelvic pain or like muscle pain or issues due to binding, or even urinary flow post-surgically. Can you tell us a little bit more about how PT can help community members troubleshoot or navigate issues that they might be having or experiencing pre or post surgically?
Gladly. I do want to remember, I forgot to say, Mattie, that you, this is probably what I wrote, that I worked at First Hill. I'm now at Cherry Hill. They moved me a couple of years ago. So that's neither here nor there, but they moved me to Cherry Hill. Still at Swedish. So I think that, you know, that the basics of physical therapy is looking at how we move and how we heal. And that may be anything from, your neck or your shoulders or your, any group of muscles, your fascia, which is sort of the connective tissue. And there's such, it's trite to say it, but it's also true that there's such an interplay between how we're feeling emotionally and what's going on with our body. It changes how we breathe. How we breathe changes the way our fight or flight system is operating. And that in turn impacts how tissue heals. We know that when people are under a lot of stress, they heal more slowly from there's interesting studies on lacerations done under a very controlled circumstance during dental students' finals week and during their summer vacation, and actually healing more slowly when they're under stress. So what I love about being a physical therapist is helping people figure out what feels like it's working right in their body and what feels like it's not working right. And without being a mental health professional, just helping people kind of set pieces of their awareness to maybe how what's going on for them stress-wise is impacting their body. And pelvic floor or the whole pelvic structures are just muscles like other muscles, except that we can't see them most of the time. And so we can carry around a lot of tension in pelvic muscles and have no inkling that we're doing that. I oftentimes tell people, if you walked around like this because you were stressed out, someone would say, hey, what's going on? But you can be doing that with your pelvic floor and have no idea. And you don't even have any idea, because if you've been doing it for a long time, it's become baseline. And that in turn affects your ability to move your bowels, to empty your bladder, and to have sexual function. So whether people are pre-surgery or post-surgery or have no intention of having any surgery, their pelvic floor may well reflect how safe they feel in the world. And certainly if people are binding, it may change how they're able to take their breaths. And so I just have fun with people to the extent that they want it to be fun. If they don't want it to be fun, we don't. I can be either very businesslike or playful wherever you're at. Sort of identifying what have been physical challenges for a body, both that can be seen and are self-evident, and those that may not be, and help people identify what's going on and what might give them a chance to unpack it and move past it if it's a problem. Does that answer the question?
Yes, thank you. I always love to hear about what you're doing and how you do it and how PT can help the body. I have yet to get PT after my top surgery, but I definitely want to.
Yeah. So I guess that the other thing I should say about people who have had top surgery is that scar tissue can be so problematic and can make it so people don't want to move. And then if they don't want to move, that reinforces it. And so helping people figure out, movement and ways to manage scar tissue, super rewarding and fun.
Absolutely. Let's talk later about this. I definitely want to hear more. So another question that a community member asked that I feel like if the providers want to answer this, that's fine. But I also know that I'm able to answer this. They asked, how will I know, or how do I know what procedures will be covered by my insurance, which is actually a really common question that we get at Ingersoll, and I'm sure that you all get from community members as they're trying to kind of navigate through getting access to gender affirming care. My answer for this is that the types of care, treatments, and procedures covered by your insurance can typically be found in your plan documents that you receive when you initially sign up for insurance coverage. This can be found in your summary of coverage and benefits, which is a quick snapshot of costs, benefits, and covered services. And then oftentimes, if you're still needing help tracking down coverage specifics, you can call the member services line, which is located on the back of your card. And also nowadays, these documents can be found on the app sponsored by your insurance company or their website via your member login. Ingersoll has created a handy dandy insurance explainer guide, which is also a great tool for learning the ins and outs of your insurance. I think that it's really unfortunate that even though all of us need insurance, most of us have access to insurance in some way, shape, or form. And some of us don't, most of us don't know a lot about insurance. And I think that that's unfortunate. And this insurance explainer guide is meant to kind of give you the basics on like, what the heck is insurance? What's in it? What does this thing mean? What does that thing mean? And those, the links to both our guide and video can be found in the comments. Just to kind of segue into like the next section, I know that a lot of you all have already answered this question, being like, how did you first learn about providing gender affirming care? But how, I guess, did you, or no, you also answered if you received training on gender affirming care in your schooling, which again, was not a lot of you. What's your vision as providers who provide gender affirming care? What's your vision for the future in terms of how providers who are wanting to provide gender affirming care can have access to this type of education in their schools? Like, what types of things do you advocate that providers do, that providers in training do to urge their schools to actually teach this as a base part of their curriculum, as opposed to kind of like an elective or spending an hour? Someone once told me that gender affirming care was a whole hour, their whole schooling career. So what would you say to folks who are like, we actually kind of need this at our school, and it needs to not be something that's an hour or an elective. It needs to be like a root part of our curriculum here.
I actually ran into, oh,
yeah, no, go ahead.
Rachel, go ahead. Oh,
Okay.
My partner and I actually ran into this with our kiddo school. She goes to a Montessori school, and the route we took was just to kind of barrel in. And fortunately, in our case, there are a lot of families who were on board, and it's a smaller school, but I think that is one really valid way. I think the unfortunate thing is that it tends to be a bit of an uphill battle of folks realizing that there's a gap, and then having to really push for those things to be included in the curriculum. I have seen some success with tapping other organizations or nonprofits or even individual practitioners who provide training or curriculum and can do that like on site. That's always a good option. I also always encourage providers that I meet to join the Ingersoll Providers Consult Group listserv, which is my favorite thing in the whole wide world. And to use that and the many other consult groups around all things gender affirming care, to collaborate and share resources and get advice and recommendations, because it's hard and every school is different. Yeah, but it takes a lot of pushing.
Yeah, I would add on to that. for people like Alyssa, who's currently a med student, the med students have been really great on pushing the institutions to do better. And I know that there is at least a couple of years ago, there was a very active student group that was pushing UW to actually have a curriculum to make this a thing. And so I think that's a good place for it to come from. I think, again, I would definitely second what Ash said. The Ingersoll provider group is so fantastic. And I've been really impressed with some CME opportunities and continuing medical education conferences. Kaiser put on a fantastic one. Dr. Colin Fields, who's at Kaiser and is a big gender education champion, they put on a fantastic continuing medical education program. And it was the first one I had seen where there was an advanced track and a beginner track. And so providers who didn't know anything and were intimidated by this could do the sort of beginner track. And then folks like me that had already been doing it for a few years could do more of the advanced track. So, so even if you didn't learn it in med school the first time, jump in, definitely.
I would just add, I think that I've been participating in with the physical therapy curricula in our local universities to I think people who have been teaching for years and years and may not be really aware of how gendered our educational content is and how we need to be shaken up a little bit and just look through the content and think about how things can be taught differently and spoken about differently, and how we can say gestational parent instead of pregnant woman, and we don't lose anything in that. In fact, we gain our humanity, and so everybody, as we gain our insights, it's kind of an imperative to circle back to the places, the paths we've come along, and refresh some nomenclature and mindsets.
Yeah, and I want to add another thing. The typical sort of guidelines, resources, sort of the more institutionalized, more staid ones, they tend to be very, very, very binary. Even those that are trans inclusive are still very binary. And so, you know, if I have a patient who comes to me and says, you know, I'm non-binary, they, them, I was assigned female at birth, but I want to be more masculine, but I am very much not, I don't want to transition to he, him. I want to remain non-binary. Can you help me with that? And I tell you, there are no like published guidelines, resources. There is no evidence-based anything for this. And so you have to find a provider. I think as providers, we need to be flexible. We need to know that, that again, this is a spectrum. And so that I find that really disappointing that there are no guidelines out there. And so I wind up, you know, you listen to your patient, you say, okay, what does that mean for you? And then you work on it together and you find an answer that works for that patient. But again, the educational materials out there are still way too binary.
Yeah, that brings me, that makes me think of what you all were saying earlier, and what I'll be saying a little bit later, which is that there's like no one way to be trans. And I think that when we, and when providers and when folks assume that there is one way to be trans, we always kind of end up coming up short. Because I think that even for binary trans folks, right? Not all binary trans folks want this procedure or this treatment or that one. And so, yeah, I think that too, in just kind of looking at what different insurances cover for trans folks, the lists are often also very binary and very limiting in how folks are able to qualify for the services that they do provide. So yeah, thank you for bringing that up. Another quick
Mattie,
question.
oh, is it okay if I add one more thing
Yes,
to what you were saying?
please.
That last piece about then having to engage with insurance and all of this arbitrary red tape around you need to have been on hormones for this many months and
Absolutely.
Socially transitioned and all of this. Another plug for the consult group and for consulting with gender affirming healthcare providers more broadly is all of the advocacy work and state level work that practitioners, at least in the Seattle area, and I know wider than that, have been doing to really try and change in some ways, find loopholes, work with case managers, and really develop systems of writing letters. I know that there are a lot of providers who offer specific services related to breaking down barriers around insurance coverage, and who will do letter writing for folks who find out about this. And, it can feel really daunting, like, I need letters. But again, this is all information that if you're coming to therapy, or if you're walking into a PT clinic or your doctor's office, you don't know what you don't know. So yeah, I don't know. It's a constant, day by day, how do we blast this information out just so people know?
Absolutely. Absolutely. And I think just tying on to that, I think too, is we know that, I think that Peg was saying this, that the medical field is very evidence-based. We also know that insurance companies are also kind of evidence-based, right? Unless there's proof that XYZ is the way that it is, or this treatment works for this, or et cetera, that it's kind of considered experimental or it's not covered. And I think that too, that takes away from honoring trans folks' ability to know who they are and know what works for their bodies and know what they want for their bodies and what they want for their health. And so, yeah, thank you all for answering those questions and offering insight into that. I also wanted to add, what tools besides the consult group or besides continuing education things do you all do to stay current and up to date in your practice of gender affirming care?
For me, there's the journal, the International Journal of Transgender Health. You get a free subscription with your membership to the WPATH. So that has evidence-based articles and well, I mean, it's a medical journal that is full of articles, and I found it really useful. I just got a new issue, and it's got an article on treatment algorithms for discharge from after vaginoplasty, and I'm excited about reading it. So it's great.
Are you able to write down the name of that journal in the chat?
Yeah, sure.
That would be fabulous.
I'm not a prescribing provider, but I would say that we're all plugging the Ingersoll listserv and the consulting group. I feel like it's my responsibility to be familiar with the issues that are beyond the scope of my practice, so I can just so people don't have to educate me about issues. I mean, my patients don't. I still want to hear their personal experience, but I feel like I should be fluent in the language. So I get my hands on whatever articles, and I'm really interested in the article that Rachel was just mentioning, because I deal with discharge out of vaginas. So I try to stay up on research. I'm fortunate enough to really have friends who are my colleagues who are also my friends, and we talk about things. And so those are helpful for me.
Yeah, like Peg, lots of friends who are also colleagues. And then my clients, especially younger clients, adolescents, teens. I feel like in my mind, I still feel like a teenager in some ways. And I'm realizing now in my mid 30s that I am having those moments of, oh my God, I'm old. Like learning so much about lingo and about books. There's a ton of great non-research literature, graphic novels. I actually have one right here. It's a visual guide on how to they, them. So I've slowly over the last couple of years been developing a little library, and when we were in person, that was kind of a fun little lending library situation. But yeah, primarily through staying up on books that are out there, and then just conversations with other providers, other friends.
Thank you for that. I really resonate with feeling really old, and feeling really old, but then also feeling like a teenager. My world of feeling like a teenager came crashing down. My daughter told her class that I was 50, and I'm nowhere near 50. So that really spoke to me. Okay. So as providers, can you all share with us any specific steps that you and your organizations take to make sure that the environment that you're practicing in is welcoming and inclusive to trans patients?
I'm a little bit lucky because I have a very small clinic and I'm a co-owner of it. And so I'm not beholden to any big, institutions. So one thing is we only have single toilet bathrooms with doors that lock. So there's no gendered bathrooms. We have a small staff, and all the staff is educated on how to ask pronouns, how to do an intake. We talk about it. We talk a lot, and we've also made it very visually obvious when you walk into the waiting room. I found like the biggest pride flag and the biggest trans pride flag I could find, and like stuck those on the wall. So like there's like a huge visual, like, yep, this is a place where you're going to be welcome. So it's lots of little things, and also I teach all my staff to just go out and greet people with a smile, like just make sure they feel welcome no matter what. And if you make a mistake, like a big smile and making them feel welcome go a long way anyway.
Like Rachel, well, I don't co-own my practice. Fortunately, I get to be my own boss, which has a lot of perks, and some challenges. But my office had lots of flags. Now I have a flag that hangs behind me. And then just, websites, all my forms, conversations with potential new clients, with parents of adolescents, teens coming to therapy, regardless of who they are and why they're coming. I think I mentioned this before, but I include all of this language as if along with like things like informed consent and confidentiality, that it's a gender affirming space, and that, yeah, there's no right or wrong way to be. And that I'm also someone who's very open to feedback. And as much as I feel like I know, there's always going to be stuff I don't. So I feel like it's also important as a provider to communicate that somehow. If I get it wrong, please know it's safe to let me know.
And I have the antithesis of all that, in that I work in a big organization, but I am very lucky to work in the same organization with Dr. Kevin Wang and Rob Reed, and people who are really powerhouse, outspoken people who are in good positions to make changes. I finally got in my clinic's intake, got them to take off height and weight and put down pronoun. So I was like, I don't need to know people's height and weight. I can, I'll be able to see things, but I would like to know what their pronoun is. So it's, I feel like I have on my shoulders the weight of the fact that Swedish is a big institution and is slow to change some things. The gender is now changeable in the EPIC system. But I will say that in my clinic, I have wonderful schedulers, and the front desk people are lovely, and they love supporting anybody who comes through the door, and they know the population that I love to serve, and they're super great. So I'm very grateful for that, and I love working at Swedish because Swedish does take all insurance pretty much, and does a certain amount of charity care, and so uncompensated care is what I should say. But so I feel sometimes invigorated by the fact that I am in an environment that still needs my pushback, but I feel like patients experience, and at least from what they tell me, it's a good experience, and there's kindness and support and basic skill. So
thank you for that. Since it's Trans Week of Awareness, I think it's appropriate for our last question to be a bit more personal, but not too personal. Some of you are trans, some of you are not, but all of you have committed your work to supporting our community, which is amazing, and I thank you for that. What words of encouragement or advice would you give to the trans person watching who is maybe at the start of their gender story and is a little bit intimidated, even bringing up the topic of transness at their doctor's office, or maybe even feels a little bit different, like I once did, and doesn't have the language or the words to describe necessarily how they feel?
Do we have time for a full session here?
Go for it.
Okay, well, no. I mean, I'm thinking of the first time I even had an inkling of, oh my God, like, I don't think I'm just a tomboy. And I happen to have a friend who is a physician at a trans affirming clinic in Seattle. And anytime I ran into her, I felt like she could see right through me. And of course, that wasn't the case. But I asked her out to coffee and sat down and was like, what am I? And what was felt so good to me was that she didn't react. It's much more of a response, and just a holding, that made me feel like, oh, this is more of a thing in my head. And I'm lucky enough to be sitting with somebody who is competent and who's actively affirming. So I think my encouragement would be, like, wherever you are is where you are. There are no right answers. Transitions in the context of gender are non-linear. In my trans and non-binary process group, one of the norms are that everyone's transition is different and unique, and there's no right or wrong way to do it. And so paying attention to language like "I'm ahead of you" or "I'm not there yet," because those terms really aren't always accurate. And that, like, it's okay to give yourself permission to explore, to not know, to feel whatever you're feeling, and start to, or try to, offer yourself kindness or trust that you're okay too.
That was fantastic. Yeah, I always realize that my therapy skills are lacking when I hear an answer like that. But what I would say is, I mean, the first thing I say to patients when they come in for gender affirming care is I don't say, like, oh gosh, I probably made some mistakes early on, but now I just say, I'm glad you're here then. This is the right place, you know, and you just sort of affirm of, like, I'm glad you're here. You don't say, great, like, what hormones do you want or anything like that. You just say, great, I'm glad you're here. And then, like, I let them lead and just let them speak. And so I would say what I would tell someone who's not sure how to start the conversation is just, I mean, if you feel like you're getting the signals when you walk into a clinic or a provider space that it's a safe space, if you get the feeling that, like, yeah, this is probably the right place to be, then I would just tell the provider, you know, that I'm starting on a gender journey, or I think I'm trans, or I know I'm non-binary, or whatever your truth is. Just open the door with that sentence, and then hopefully the provider will affirm that and then let you lead from there. And if they don't, then it's not the right clinic.
I feel like my paradigm is different because I'm not in Ash's position of, I sometimes joke, I have two siblings who are psychologists, and I sometimes joke with them about the fact that I really can talk with people about anything while I'm with them, because there isn't sort of a talk agenda. They're not at a discovery, other than that I want them to learn something and I want to hear what they have to say. And I'm not providing medication for them. And so what's important to me is that they feel safe in my clinic. And I didn't mention earlier that we have single bathrooms, and also I have the gift of some artwork from a friend of mine who is a medically trained artist who's a trans person. And so I have beautiful illustrations of pelvic muscles in where I don't have a poster that says female reproductive system and male reproductive system, because that just grates on me. And so in my work, I just get to, if I'm talking about a body part, I can ask people what word they use for that body part. But really in the course of what I do with the people that I work with, I want them to feel like they are able to move well, they have the strength, they have the range of motion, their muscles are coordinated properly, their incisions are healed properly, and they're gender identity is as much or as little a part of the our work together as they want it to be. It almost doesn't matter to me. I want them to be comfortable. So I sort of feel like that's a privilege. It's like, you know, and if it switches over the course of the time that I'm working with them, and they want to change my information about the pronoun or whatever, we just go along with that. So that feels, I guess in that sense, but the course of my care and the time I spend with them is a little bit different from what my esteemed fellow panelists, Ash and Rachel, are saying. A little bit looser, maybe.
Thank you all so much. I like this question so much that I think I'm going to answer it, be a little vulnerable with everybody. I think, so when I first kind of felt like a twinge of whatever, I had no idea what trans was. Both of my parents are immigrants. And so I came out as gay in like junior high, and like my dad thought that was funny because he's like, oh, Africans aren't gay. Like that's it's because you're in America. Like that's not a thing. And I remember not coming out as gay, but not quite figuring out like why that didn't all the way fit. And I remember thinking about thinking in terms of gender roles and feeling like because the world saw me in this gender and these roles that went along with that gender, that my behavior, my opportunities, my options in life, whether it's like what I wanted to be or like what I wanted to wear or like just everything was really limited. And I remember second guessing myself a lot. Instead of moving deeper into why I didn't quite feel one way or the other in terms of my own gender. And it took me till, God, like damn near 30s, maybe like late 20s to kind of figure out like, oh, this is what that was. And now I have the language for it. And so, yeah, it's difficult, but I would say for anyone watching, just don't second guess yourself. I feel like trans folks are chronically not believing themselves because the world doesn't believe us. And I think that we're conditioned to not trust who we are or trust how we feel about ourselves. And that, you know, creates this like bubble that you're in that you feel like you can't get out of. And for a lot of people, it creates a lot of dysphoria and a lot of confusion when you know, and deep inside you've always known, you just maybe haven't had the words or the experiences or the support in order to like listen to yourself. So I guess I want to tell folks that you aren't crazy. You aren't nuts, because I certainly thought that I was at one point. You're listening to yourself. You feel different because that's your intuition, and your intuition is telling you something, and you're trying to listen to it. You're trying to turn that whisper into, you know, into a yell. And I would say to listen to yourself for as long as it takes for that whisper to turn into like a stadium going nuts. Yeah. And I think with that, we are drawing to the end of our program tonight. And I just want to give a huge thanks to the providers who were able to share their knowledge and advice with us. Ash, Rachel, Peg, we really, really appreciate the work that you do for our community. And I want to leave you all watching with the appreciation and love that we have for our community. Transweek of Awareness is a time that I often think about the folks who are out there struggling with their identities and feeling as if they need to act, dress, or go under the knife in order to be validated in their identities. And I think about folks who maybe don't have the space and support to be who they are. And to that, I want to reiterate what everyone was saying tonight, which is that there is no one way to be trans, that you are loved, that you are cared for, and if not by those around you, then by us at Ingersoll, by some of these great providers who have showed up today, and some of the amazing trans collectives and orgs in the city. Be well, stay safe, and wear a mask because ew. And good night.